I want to update on the steps we're taking to protect some of the most vulnerable people in our society. As the Prime Minister set out this week, we've now passed the peak of the virus, and he will provide more details on how we will address the second phase of this battle next week. We all know that the restrictive measures, as necessary and as life-saving as they are difficult for everyone. All of you watching at home this afternoon have made sacrifices, big and small, and I want to thank you once again for all that you're doing. You're helping us as a country to turn the tide on the virus. But for some in our society, these measures involve sacrifices that none of us would wish anyone to bear. For victims of domestic abuse, it means being trapped in a nightmare. The true evil of domestic abuse is that it leaves vulnerable people, including children, living in fear in the very place where they should feel most safe and secure, inside their own home. Though domestic violence can leave physical masks, the true extent of the inflicted pain is much deeper than those marks. It can be invisible. These are emotional scars, and scars that for some will never heal, and which can even pass to the next generation, whose young eyes see things that they never should, and hear things that none of us would wish our children to witness. As a father of 3 girls, I cannot even imagine women and young children being put in this situation, but they are, and we must be alive to the reality of what is happening in all too many homes across the country. I want us to defend the rights of those women and those children wherever we can, and that is what we're going to do. And this is not a crime inflicted solely on women. It affects men too. This government has already prioritised tackling domestic abuse. The Domestic Abuse Bill, which had its second reading in Parliament last week, is a landmark piece of legislation which will create the first ever legal definition of domestic abuse. And this is important because it holds those responsible to account and gives those suffering at the hands of others more confidence that action will be taken and perpetrators brought to justice. Today, I can confirm that through the Domestic Abuse Bill, the government will also be ensuring that the victims of domestic violence get the priority need status that they need to access local housing services much more easily. This is a fully funded commitment which will mean that no victim of domestic violence has to make the unbearable choice between staying somewhere that they know is unsafe or becoming homeless. This government has been clear that we are determined to break the silence that surrounds victims, to stamp out the stigma and to strengthen our support for survivors. We've already announced an extra £15 million to strengthen our support, and an extra £16 million is going directly to refuge services. But we recognise the extra pressures that are being created due to COVID-19, and that necessitates more support. While the necessary social distancing measures remain in place, it is harder than before for victims of domestic abuse to reach out to their friends, to their family, to colleagues and to neighbours for the support that they urgently need. Today I can announce a package of over £76 million in new funding to support the most vulnerable in society during the pandemic. This funding will help charities support survivors of domestic and sexual abuse. it will support vulnerable children and their families, and it will support victims of modern slavery. This additional support will ensure more safe spaces and accommodation for survivors of domestic abuse and their children, and the recruitment of additional counsellors for victims of sexual violence. And this funding will also help frontline charities to be able to offer different ways of supporting those in need, including virtual or phone-based services. We know that some refugees have had to reduce or even to cancel the services that they would want to provide during the pandemic. This funding will help them to meet the challenges posed in this national emergency and to continue to help those that desperately need support. I'd like to say a word of thanks to domestic abuse charities who are doing so much at this time to help so many people. The Women's Aid Refuge in my constituency is one example, and I'd like to thank Marlene and her amazing team in Newark. People like that do incredible work and deserve all our thanks and gratitude now more than ever before. Where refugees don't have enough capacity to support those in need during the pandemic, some have asked us if they could use hotels or other accommodation nearby on a temporary basis. For example, as move-on accommodation where they judge it to be safe and appropriate to do so. We will work with refugees to make this option available to them if they judge it to be the right one where it's necessary. And thank you also to pharmacies such as Boots, who are providing a safe space for victims of domestic abuse in some of their shops and are training more of their staff to be able to support those people when they come into the stores, so they can safely provide support and contact services for help and advice. And for victims of domestic abuse watching at home this afternoon, let me say once again that you are not alone. You do not have to stay at home. You can and should leave the home if you're in danger. Victims should call 999 if in an emergency, or if you're in danger and you're unable to talk, call 999 and then press 55. Our outstanding police will be there for you. They will help you. And if you need support, please call the National Domestic Abuse Helpline on 0808 2000 247 at any time. Secondly, we've also been working with councils and charities to protect those who have been sleeping on our streets, a group that we know are particularly vulnerable to COVID-19. We set out to bring people in from the streets. So far, more than 5,400 rough sleepers known to councils have been offered safe accommodation in just under a month, ensuring that some of the most vulnerable people can stay safe during the pandemic. This means that over 90% of rough sleepers known to councils have been offered accommodation where they can self-isolate in safety during the crisis. This country is now viewed around the world as having taken one of the most intensive and successful approaches to protecting rough sleepers during the pandemic. This was the right thing to do. By working with charities, local councils, churches, faith groups and volunteers, we've helped to protect thousands of lives. I'm extremely grateful to everybody who's been involved in this phenomenal national effort. Today, I'm announcing that Dame Louise Casey, who is already leading a review into rough sleeping and advising the government on ending it within this Parliament, has been appointed by the Prime Minister and I to spearhead this new government initiative and she will lead a new task force. In this role, she will oversee our national effort to ensure that the thousands of rough sleepers now in safer accommodation continue to receive the physical and the mental health support that they need while they self-isolate during the pandemic. And she will work hand in hand with councils and with other groups across the country to plan how we can ensure that as many people as possible can move into the long-term, sustainable and safe accommodation that they deserve once the pandemic is over. We're determined that as few people as possible return to life on the streets, and I can think of nobody better than Louise to help us to achieve this. This is a major challenge, and I don't pretend that this second phase will be easy or that we will succeed in every case. But we will apply the same energy and commitment and determination to this national effort as we did to the first. And I'm certain that the charities, the councils, the volunteers, the people across the length and breadth of the country who have achieved so much in the last month will do the same job again. Thirdly, and in closing, I'd like to update you on our shielding programme. For those who have been identified by the NHS as being extremely clinically vulnerable due to underlying health conditions, that's now 1.8 million people in England alone, they have been asked to stay at home with no face-to-face contact outside of their household except for their carers. For those of the people in the shielding group who don't have family or friends to support them, we've offered to provide a basic weekly package of food and essentials. And I'm delighted to say today that we expect that the 1 millionth shielded package will be delivered in the next few days. This service is entirely without precedent. Nothing on this scale has been attempted in this country, at least since the Second World War. I'm incredibly proud of the team who've helped us to deliver it. I've loved reading the emails that I've received from people who've got the boxes and seeing the photos that have been posted on social media. I said at the start of the process that there are many people who we are asking to stay at home for a prolonged period of time as a result of the virus, not least in the shielded category, but that we as a government and as a country are determined that they may be alone at home, but they shouldn't feel that they're on their own. You're not alone, and you never will be. Thank you very much. Jenny.
Thank you. So earlier in the week, the Prime Minister made it very clear that we had passed the peak of the epidemic in the UK, but also that we had a lot of work still to do. And in the data that I'm going to present today, which shows all the hard work that everyone at home has been continuing to do, we still do need to keep in mind that we have 5 tests that we need to apply for adjusting the lockdown. So the first one of these is that the NHS has sufficient capacity to provide critical care and specialist treatment right across the UK, and we'll look at the data shortly. Secondly, a sustained and consistent fall in daily deaths from coronavirus. Thirdly, we need to have reliable data to show that the rate of infection is decreasing to manageable levels across the board, and the increased testing capacity now and the new seroprevalence testing will all add to our ability to understand infection rates across the UK. Fourthly, there are operational challenges, including maintaining that testing and in the PPE, and that these are all in hand with supply able to meet future demand. But I think the fifth one is the one that we all need to keep in mind as we go forward. We have to be confident that any of the adjustments to the current measures, which have worked so well to help everyone keep safe and to manage the peak and keep the NHS working through. But those current measures need to be very carefully adjusted in order that we do not risk a second peak of infections that overwhelms the NHS. Next slide, please. So how have we been doing? So we've often seen the transport use change, and I know we've had a little bit of concern perhaps that motor vehicle usage has flipped up a little bit, but we do know from other evidence that in fact the number of social interactions has stayed very low. And the fact that the R rate, the transmission rate of the disease, is down suggests that all of these fit together. So a very significant drop in transport use accompanied by very good adherence to social distancing. Next slide, please. As you can see here, and as the Secretary of State has said, we have had a massive increase in daily testing, and you can see that as we've gone forward. So over 105,000 tests in the last 24 hours up to 9 o'clock this morning. That will continue, and if we look at the next slide, we can see how that is now panning out between the NHS testing in blue and the orange testing, which is the growth in the wider testing capacity. Now, obviously, as the number of cases requiring clinical care in our hospitals drops down, and you can see that in blue, the orange testing pillars are rising up. That is despite the fact that actually in the NHS, all patients coming in to the NHS now are being tested. So there's likely to be a drop-off because of the reduction in the number of positive cases, but there will then start to be a bit of an increase again in our blue pillars as we consistently test through hospitals. Next slide, please. This is the slide, I think, which makes it very clear what has happened with our NHS capacity. This is a slide of the number of people in hospital with COVID-19, and you can see that over the last week, the number has actually decreased by just over 13%. And London, which was clearly very significantly affected, has now come back down to the sorts of levels that are seen in other areas. Of course, that never means that people on the front line are not continuing to have to work really hard, but it does demonstrate that the pressure on the NHS is now moving down, and we recognise that in the fact that some NHS services are now planning to ramp back up again. Next slide, please. So again, this reinforces that message. So obviously the sickest patients will require critical care, and this is our critical care bed use with COVID-19 patients. And again, in all countries in the UK, we've seen the rise as the peak in the epidemic has moved on, and those case numbers now are starting to come down. Next slide, please. And then these are the sad deaths associated with COVID-19, and as we're now reporting, these are across all settings. The blue bars are the daily totals, and I think we are very familiar now with the fact that sometimes those individual totals can be recognised, the delay in some of the reporting, but the orange line, the 7-day rolling average, gives us an indication of just how the death rate is now starting to come down very gradually and very slowly, and it's really important that we continue to practice social distancing and watch that come down still further. Next slide, please. And then finally, with all the difficulties that we have of comparing data globally, the UK data there in black is all settings, so this is as comparable as we can get with other countries. Eventually we will look back and see how that compares with different mortality statistics, but for the time being I think that gives an indication of where the UK is, and hopefully that's now starting to flatten out. Thank you.
Thanks, Jenny. So the first question we're going to go to is from a member of the public, and it's from Ashley from Yorkshire, and Ashley's question is going to be shown in a short video.
The World Health Organization has recently suggested that people who have already recovered from COVID-19 may not be immune to a second infection. What evidence is there to suggest that people can catch COVID-19 twice, and how would a vaccine change this? Thank you.
Jenny.
Thank you very much, Ashley. So quite a complicated answer, and I'll just try and summarise. I think the WHO position is very similar to the one that we would have. It basically says we actually don't have enough information yet to be very clear on the immune status. We know that some people will have different status. We would normally expect to see some sign of immunity about 10 to 12 days after an infection, and then a very consistent pattern about 28 days. But there's sometimes a delay in different individuals, and we need to study this really carefully as we go forward. Our testing policy and the development of new antibody tests will help us do that. I think there's some good news and some not so good news. So I think, for example, in the elderly, we know that antibody responses can be quite problematic. They tend not to respond as well. So this is clearly a vulnerable group. And so for them, we sometimes have to make different preparations or pay particular attention to vaccination policies. But I think we're also starting to see, with some very small pieces of evidence now from people in this country who have had COVID-19, and we know they have been tested positive, and then we have looked for their antibodies, that a very large percentage of these who've otherwise been pretty well do actually have quite a good response. How long that's going to last, and whether it will just provide an antibody response, say, for one season or for 2 or 3 years ahead, we don't know. So still lots of uncertainties, but I think still a lot of positive hope for a vaccine.
Thank you, Jenny. And the second question from a member of the public is from Paul in the East Midlands. And Paul's question is, the Trussell Trust have reported an 81% increase in food parcels to those in desperate need in the last 2 weeks of March alone. What more will the government do to help those who were already in dire need and which has been made worse because of coronavirus? Well, it's a good question from Paul, and we know that the impact of the virus affects us all. It's indiscriminate, but we know that some groups in society are affected particularly seriously. And so the response that the government has taken has been to try to support all of those in society. I've already spoken about those who we've asked to be shielded because of specific clinical conditions, underlying health issues before the advent of the virus. Those individuals have access, if they need it, to the food parcels delivered centrally by government. I'm also working as local government secretary with local councils who have done a fantastic job at bringing together community groups, faith groups and volunteers in different parts of the country to ensure that other vulnerable people, the elderly for example, can get food and medicines and essential supplies that they might need, even if they're not technically within the shielded category. And there are hundreds of thousands of food parcels and other supplies being delivered by them every day all over the country. And if people want to volunteer to support those efforts, then I'd encourage you to get in touch with your local council, who has probably set up a hub to organise that work, or to go onto the Good Samaritan app, at which you can see opportunities to volunteer being posted there. And then, of course, through our economic response, we've set out to try to help as many different people as we possibly can, whether that's through the job retention scheme, to try to ensure that those people who are in work can retain the essential link with their company so that they can get paid and can return to work when we start to ease the lockdown measures and the economy can bounce back as quickly as possible. For those who were already in the welfare system, we've tried to make that more generous in a number of different ways, through universal credit, through the local housing allowance, for example. And there are other ways that we can take action as well. I've set out today a number of ways in which we're trying to support particularly vulnerable groups, such as rough sleepers on our streets. And as I've said, we've made some significant progress on that. But some of those groups will need consistent support and care from us as a government, from local councils and from society in the weeks ahead. And then obviously in the future, we want to ensure that we emerge from this crisis as strongly as we can and support those people as we begin to rebuild the economy and people's lives more generally. Now, I'm going to turn to the first question from the media, and that's from Chris Mason from the BBC. Good afternoon, Chris.
Yeah, good afternoon to you, Secretary of State, and good afternoon, Dr. Harris. A question for each of you, if I may. First one to Mr. Jenrick. We're hearing a lot about the potential loosening of the lockdown in the coming weeks for many people, but as you've been touching on, there are a good number of people who are shielding, who are contemplating many more months potentially of being stuck at home. Now, most will acknowledge the unprecedented nature of what you have done so far, but I wonder what long-term plans there are to help those people out, not just in terms of the provision of food, but also their mental health and their general well-being. And a question for Dr. Harris, and a request for an update on track and trace, if I may, in the context of the scaling up of testing capacity. I'm wondering how many daily tests you're going to need for the track and tracing in a few weeks to be able to be fully operational. I wonder where we are in terms of an update in the staff that are being trained and the extent to which that system needs to be fully up and running before we'll see any noticeable shift in an ease of the restrictions around lockdown.
Thank you very much, Chris. Well, if I answer the question firstly about those people we've asked to be shielded, and it's a good question because we've now got 1.8 million people in England alone who, for clinical reasons, are extremely vulnerable to coronavirus, who we've asked to stay at home. And when we initially did that, which began 5 weeks ago, we said that it would be for a minimum of 12 weeks, which was a very significant amount of time. And we appreciate the huge emotional impact that has upon people about not having access to friends, to family, to the outside world, as well as the practicalities. We've tried to support people with the practical steps. As I say, for those people who don't have access to family or friends or neighbours nearby, they can, if they need, have our food boxes delivered to them, and we're now delivering 300,000 of those every week. We appreciate that that's a fairly rudimentary service, so we've also helped those people by sharing that data with the major supermarket chains. So if those people would prefer not to receive our food boxes, they can get privileged deliveries from their supermarket of choice. The NHS, through the pharmacy network, is also trying to help them to get access to the medicines that they would ordinarily rely on. And local councils are also being shared the data on who those people are within their local community so that they can step in and provide more support and more tailored support to those people. So if you have particular medical or dietary requirements and the boxes don't suit you, then local councils can step in and provide a better quality of service to those people. We're also encouraging councils to begin a check-in and chat service so that we get as many of those people as possible phoned up, usually by volunteers, but sometimes by council staff, to just make sure they're okay, they're getting the supplies they need, and if there's anything else that they need, we can try to step in and do that. There's also a concern about people's mental health being confined at home for a long period of time, but particularly those people who don't have anybody else in their household. And so we're working with national charities who have the expertise there to try to support those individuals. I think there's a question about what we do next, and we are thinking about what further steps we can provide to people if they're being asked to stay at home for an even longer period than they already have, and whether there's more that we can do to ensure they get all of the support that they need. I don't know if Jenny, there's anything you'd like to add to that or answer Chris's other question.
Absolutely. So just picking up the shielded group, I think from a clinical perspective, when the epidemic came to the UK, clearly we had limited evidence and we have used first principles and plausibility to understand who we thought would be most at risk. Now, in fact, as time goes on, of course, we get far more evidence, both from overseas and from treating our own patients. And some of that evidence, we're starting to see differential clinical conditions. So, for example, not just respiratory conditions, but issues to do with the immune system and with clotting, for example. So, but we also have a very strong trial process, looking at different drugs that might be useful. And in fact, some of the things are giving slightly perverse answers. So, for example, a drug which an individual might normally take, say, for very severe arthritis, which you would expect to suppress their immune system, might actually be quite helpful in the mode of action in COVID-19. So in brief, what we are doing is trying to review that, because we do recognise that asking somebody to stay shielded for their own health protection for a very long period of time, and it may be several months, is quite a difficult thing for them to do. So we're doing two things. One is actually looking at those risks again. Now we have more information and try and build a better, more stratified picture. And then the second one is that working with NHS England, looking at what clinical needs these people might have and how services could be adapted for them over a much longer period. And that includes things like mental health services to people who are at home, or how one can safely and consistently provide virtual services to this group, and at which point you shouldn't do that and you should actually ask them to come into a clinical setting. So both the longer term clinical management and the risk going forward. So that probably helps that one. The one around track and trace, so clearly we will want to be testing this going forward in a small way before rolling it out. I think there are still a number of uncertainties, all of which are under consideration. Very exciting in the sense that for viewers who perhaps don't understand the principles, clearly it's about if somebody has symptoms, they take themselves out of society as they would now, but anybody who has been in contact with them in a very anonymised and safe data managed way using a phone app will be alerted. Now, there are some key points here. So the testing one, which you highlighted, clearly we want to have very quick tests. We do not want to be asking contacts to stay isolated for a long period of time if the initial person who triggered the alarm, so to speak, actually turns out not to have COVID. So there's a speed issue. It's also an issue that not everybody will be able to operate a digital system. So elderly people are unlikely, perhaps more so, less likely rather, to be using an app on a mobile phone. So it needs to be a hybrid system. And you highlighted about contact tracing. It can sound quite simple, but actually we need to be looking forward and backwards as well. We need to be asking lots of questions. So I think Public Health England have already said they're looking for around 3,000 clinical staff and 15,000 tracing staff. All of that discussion is on. There are some very experienced people already in public health teams in local authorities, for example, working under directors of public health and in Public Health England as well. But clearly to get this up and running at scale and effectively is another significant task, but lots of preparation underway.
Great. Thank you very much, Jenny, and thank you, Chris, for the question. Our next question comes from Dan Hewitt of ITV. Dan.
Yeah, did Chris want to follow up? Sorry, I think Chris tried to follow up then.
I didn't hear Chris.
Could I do briefly?
Well, if you want, Chris, yeah.
Very briefly, and Dan, thank you. I appreciate the courtesy. I'll keep this quick. Secretary of State, you talked about you're thinking about what further steps around helping for the shielding. I just wonder if you could elaborate on what they may be. And briefly, Dr. Harris, that seemed like quite a long list of things before track and trace can be fully up and running. Is it a long way off?
Well, for the shielded, I think one priority is to ensure that those who want to move off our food boxes onto privileged access from the supermarkets can do so. And the supermarkets are doing great work in increasing their capacity to do delivery services. And as capacity rises, we will have more options to help the shielded to get access to those services. As I say, we'd like to do much more for people's mental health, and that's working with charities like Mind, for example, who have the expertise to do this. And we are working with local councils to check in with people more often. If there's more that we need to do and more bespoke services, particularly for the most vulnerable people in this category, then obviously we will do. You've got to remember there's a broad range of people within the shielded category. It's not all the elderly, for example. There are a number of younger people. There are children within the shielded category living with their parents. So we'll need to come up with more tailored answers, I think, if the shielding programme is to continue for a longer period of time. And so we're looking at the different types and groups of people within shielding and what in particular those people who don't have family, friends and neighbours to support them might need if this is going to be sustainable in the longer term.
Thank you. You asked about time period. I think both yes and no. So for a whole population, we need the whole population to work with us on this. It's quite an exciting adventure. It's a bit like social distancing. Everybody has to do it together to get it to work. And on the example of how people have worked on the social distancing, I'm sure this will be successful. But if we want everybody to do it, we have to be absolutely sure that it will work. And so the short question is, no, we need those answers, but we need to be trialling it, and we will be doing that very soon.
Very good. Thanks, Chris. I hope that answers your questions. Dan.
Thank you. Good afternoon to both of you. First of all, Secretary of State, Rolls-Royce is the latest business within the aerospace industry. We understand could cut thousands of jobs with the British workforce bearing the brunt. Given we've seen job cut announcements from British Airways and Ryanair this week and the decimation of the aviation industry as a result of coronavirus, what more is the government prepared to do to help this industry? And a question to Dr. Harris, if I may, following up on what Chris was talking about, contact tracing. Could you define exactly what you mean by contact? So what level of contact are we talking here for someone to then isolate?
Oh, well, thank you, Dan. Well, obviously the aviation industry is both an extremely important one strategically for us as a country and one which employs a great deal of people across the country. So it's one that we want to support in any way we can. We are very conscious of the challenges it faces. Lockdown in the UK as around the country, around the world is posing enormous challenges to it, and it's grappling with what the longer term demand for its services might be in an age in which social distancing will be important and in which business travel, for example, might be different. We've obviously put in place unprecedented support for businesses, and that applies as well to the aviation and airport sectors. The job retention scheme, for example, is available to the employers that you've just listed. I know some of them are already making use of it, and as a country, we're paying part of the wages now of millions of people. That's the right thing to do. It's to protect people's livelihoods and to retain that essential link between the employer and the employee, so that when we are able to reopen those parts of the economy, we can hope that there's less economic scarring and more people can return to their companies and the economy as a whole can bounce back. But the Transport Secretary and the Chancellor are particularly focused on the aviation sector, and as local government secretary, I'm particularly focused on those parts of the country that rely on their local airports, like Manchester Airport, for example, which plays a key part in its regional economy. If there's more that we can do to help and support them through a very difficult period, we will do so. Jenny.
Thank you. Whether it's COVID or not, any infectious disease, the traditional way, if you like, which is what we will use here, but with an app, of trying to contain the spread of the disease, identify those people who may be at heightened risk, at heightened exposure of whatever the infectious agent is. Now, we always talk about close contacts, but a close contact may vary with an individual disease. So if we look back at Ebola, for example, it is a contact transmission. Somebody touches somebody else, body fluids, that is the prime route of transmission. In this case, of course, there is a respiratory risk of transmission. There is also a contact one, obviously, which is why we're all washing our hands as well. But the respiratory route is the prime route into the body for the virus. So there are a number of different categories of contact that we would describe as close contact. So the primary ones usually are people who are living in the same household, and that is, of course, why we have self-isolation and family isolation rules if you're symptomatic. But it may be a particular, if you've been in an environment, so for example, in close face-to-face proximity with somebody who is known to be symptomatic or be positive, that also would be a close contact, and the individual would be at heightened risk of disease. The other issue about it is about the time that you have spent with them and how far away your contact with the individual was. So whether you're close to them in proximity, we're actually physically, but equally how long ago you met them, because if you if somebody had their disease more than 14 days ago for an incubation period of 14 days, you're probably out of that risk. So number of different elements that we look at to classify whether you're a close contact, but all of them the same underlying principle. And what the contact tracing will do on the digital app is identify people who have been in close proximity to a person who declares themselves symptomatic or is positive on testing. So it doesn't solve all the issues of contact tracing, and that's why we need the army, if you like, of individuals to follow up with some of these to identify other routes that are the risks perhaps that could be associated with a positive case.
Thanks, Jenny. That's very comprehensive. Dan, is there anything, a further question you'd like to ask, or are you content with that?
Quickly on the Rolls-Royce question, the Chancellor has previously said that he would consider potentially a bespoke support for the aviation industry only as a last resort. I just wonder what that last resort will have to look like before maybe the government could consider or would consider a specific package for the aviation industry beyond the measures you announced a moment ago.
Yes. Well, look, both the Chancellor and in this case the Transport Secretary, but the Business Secretary are working with all sectors of the economy. I certainly am in my own area of housing and construction to understand the specific concerns that they face, to help to guide them as to what the second phase of the virus might mean, or the second phase of our response to the virus might mean in terms of social distancing and the way that we can begin at the right time to reopen our economy. We've tried to design the specific interventions that we've brought forward, like the business loan scheme, for example, to be as helpful as possible to those key sectors. But if there's further steps that are required, then I'm sure the Chancellor and the Business Secretary will think that through in conversation with major employers like Rolls-Royce. If I could take the next question now, please, from Harriet Line from the Press Association. Good afternoon, Harriet.
Good afternoon. Secretary of State, how will you manage to do contact tracing successfully if not enough people download the app? And will the level of download be key to a decision on when to lift the lockdown measures? And to Dr. Harries, on the 4,000 new cases of coronavirus you just mentioned, do you know where people are now getting it? Do you have an estimation of how many of these cases are frontline workers or patients in hospital or people picking it up in supermarkets?
Thank you, Harriet. Well, contact tracing will rely on all of us in society playing our part, but I'm optimistic about the prospects for that. This has been a national effort so far. If you think of the different measures that we've brought forward, the restrictions, the vast majority of people have got behind it, and I think that they will do again when we're able to launch the app on a national scale. And the NHS in this country is particularly dear to all of our hearts, and so I think there's every reason to believe that the UK of any country will take this seriously, that people will download the app and will play their part. But the app is one important element of contact tracing, but it's not the only one. There will also be, as Jenny has said, the people that we'll be recruiting to be making contact with individuals and those who they've come into contact with. So it will be a multifaceted strategy with the app at its heart, but with well-trained individuals to try to support it as well. Jenny.
Thank you. Yes, it's an interesting question. When you have a large number of cases in the community, we have sustained community transmission. It's perhaps not, it's not as easy, but it's also, if we're asking everybody to stay at home, actually doing the individual contact tracing doesn't contain disease. People are sitting at home and containing it themselves effectively. And as you've highlighted, this whole combination of digital apps, contact tracing, and understanding where pockets of transmission are that can be contained potentially as we go forward to get us out of the social distancing measures is really important. There are some areas where we know, and we always look to see what that is, because we will have community elements, but we also know that clearly many cases will be treated in hospitals. So that's one area where we look in detail. We also have a very particular focus on social care environments and care homes at the moment. And then as we get the results from the contact tracing, we will start to understand where the lines, if you like, of transmission are. It's not possible to do that when there are huge numbers of people with the disease in the community. But as we're starting to drop that down, we can follow some of them through. And I think one of the really exciting things, we understand by a number of different routes. So we have an ONS surveillance programme on, understanding not just the prevalence of disease, but trying to look at how that perhaps spreads within families. So we start to build a picture up of how the virus spreads in communities. But I think also there are some genomic studies, so looking at the whole genome sequence, which allows you to see over time where one individual perhaps has passed the same genomic sequenced virus onto the next person. And that is very interesting work. It's still in quite an early phase, and I think we will learn a lot from that. So the whole combined means we start to understand disease transmission and very importantly, how we can contain it going forward.
Thank you. Harriet, are you content with that, or have you got a follow-up question for Jenny or myself?
Just on those new cases, so you don't have a breakdown of where those people have come from. Presumably they're going to testing centres because they tick one of the boxes. So have you not got data to show whether they're frontline workers and then testing positive?
We do. I don't have that data to be able to give that to you at the moment. But clearly, as we do more tests as well, we will get more information back from the testing in an anonymised way to understand actually where the prevalence of disease is heightened. So yes, absolutely, we do look at this, and there are a number of subgroups, nosocomial, so that's infection spread, if you like, in care settings and in care homes, where we're absolutely focusing on that because we're looking for any opportunities to interrupt transmission and make sure people are kept safe.
That's right, and we have a particular focus on care homes and ensuring that the tests are getting to those people who need them there, and that's both the tests that are delivered to people's homes, which is the most accessible way of getting a test, particularly if you're a busy care home worker, but also using the mobile units. And so in scheduling the mobile units progress around their local areas, we're ensuring that local councils and the local resilience forums play a part so that they come to locations which are actually accessible to people who are working in care homes. And more of those units will be available next week, and will be particularly focused on trying to ensure that not just capacity is there, but it's actually readily available and accessible to those people who need it the most. An important category of which will be care home workers and residents. Thank you. Our next question comes from Toby Helm of The Observer. Toby.
Hello, a question for the Secretary of State first of all. It seems like an age ago, but it was a few weeks ago that Sir Patrick Vallance and Professor Whitty were telling us that we were much more likely to catch coronavirus having a pint with our mates in the pub than we were to go to an outdoor mass gathering football match. Can we take it from that, therefore, that as we consider measures to ease the lockdown, that we're likely to see permission given for mass gatherings to resume before we will see permission for pubs to reopen? And if not, why not? And a question for Dr. Harris, if I may, just following up from my colleague from the Press Association there. Can we assume that the number of new cases of infection, which are quite high, I see today, that there is a much higher proportion of new cases among frontline NHS and care home workers than the general public at large? And what does that tell us about our failings in delivering PPE on time to those workers?
Thank you, Toby. If I answer your question to me first, before handing over to Jenny, the Prime Minister has said that now that we have passed the peak of the virus, it's the right time for us to begin to consider how we should be responding as a country in the next phase. And he's going to be setting out next week in more detail our thinking in that area. And to inform and advise him, across government, we have been thinking about different settings, whether that's in the workplace, on public transport, in schools, or outdoors, what sorts of steps might members of the public, families or employers take to ensure that those settings are as safe as possible when it is right to ease the restrictions in those particular settings? The very strong advice today is that that moment has not yet come, and that members of the public watching this afternoon should continue to stick to our message, which is to stay at home, protect the NHS, and by doing that to save people's lives. But you're right to say, and Jenny can give her medical opinion to this, that the rate of transmission is significantly less outdoors than indoors. And so when it is right to ease lockdown measures, that will be a factor that we will take into consideration. But obviously there's an interconnectedness between that and other things like public transport, which make this a more complex picture. And that's the type of analysis that's now being done across government, informed by SAGE and the medical experts, so that the Prime Minister is in the right position to make those decisions at the right time. Jenny.
Thank you. It's probably quite a helpful example for explaining to people these apparent discrepancies in advice or understanding. The real trick in your question is whether you go to the outdoor event via the pub or whether you leave the pub journey out of it. So the virus itself will not survive as long in the outdoors, ultraviolet, all sorts of things. So generally outdoor environments are safer, and you'll see from a lot of our advice, people who are inside, we suggest that they open the windows and let fresh air in. So generally outdoor environments are safer. But it depends how you go to your outdoor environment and what you do. So if you go as a family unit and sit in one place and you've got the same exposure there that you would in your house at home, that's probably quite a safe environment. If you go with a whole load of friends that you haven't seen from before the coronavirus lockdown, sit in a pub in a very small environment, lean well over each other on the table and stay there for some hours face to face, that's really not a good thing to do. And I think sometimes people will get confused with the activities that they do before the event and then the event itself. The other example, of course, is people all piling into cars together, and that is a potentially high risk. If it's your family unit, you're all exposed to the same as you would be at home. But if you pick up all your mates on the way to the outdoor event, not a good thing at all. So don't go to the pub on the way is probably the one to reduce your risk, although I recognise that everybody is wanting to do that. You were talking about new cases, I think, and the proportion. So I think as a doctor, if I go to work in a clinical environment, I recognise that my risk generally, whether it be COVID or other diseases, is higher simply because we are treating patients with illnesses. And we do recognise that there will be some transmission potentially within healthcare settings, and that does apply. And I think we're starting to see very strong evidence, both from internationally but also very specific initial studies we've done in this country around care homes, which is why we have such a strong focus on care homes. And there is an issue in care homes. There's a particular issue because the residents themselves may not show the same symptoms that we might have, and maybe not show them as early as younger people. So yes, we do expect to have higher rates, and yes, there are studies ongoing. Clearly, if infection prevention control measures in healthcare environments are not good, and that's not just about PPE. PPE is an important part of it, and we need the PPE at the front line, but it is also about systematic processes of managing infection, because when we're using PPE, it sits on this background of continuously washing your hands, disposing of things carefully and safely. So PPE is an important element, but it will not be the only one, and we are looking across different healthcare settings to see if we can identify where there are particular risks perhaps. There's quite a lot of variation.
Thanks, Jenny. Toby, would you like to ask a follow-up question, or have we...
Just very quickly, because I know everybody's on deadline, but just to the Secretary of State, so could we therefore, would it be right to assume that we might expect greater and faster relaxation of sort of outdoor socialising rules than indoor socialising rules? Just
we're going to be setting out our thoughts next week on that, so I can't go into much further detail on that for you now. But obviously we'll be guided by the scientific evidence, and as you've heard from Jenny and myself, there is evidence that outdoor settings are better, but it's highly interconnected with other factors, as Jenny elaborated very well, including how you get there, and whether you're mixing with people outside of your own household. So it's not quite as simple as it might seem at first glance. For now, as the measures are certainly still in place, we're very focused on, are there safe things that we can do which do make the lockdown more bearable and livable for people, and those often are outdoor activities. So, for example, we've worked very hard to ensure that all parks are open, and all bar a handful in the country are now open, that people can go visit cemeteries and graveyards to see their loved ones' graves, and that, for example, you can go and visit the local tip and take your rubbish and recycling there, as long as you do so safely, only with your household and observing social distancing measures. So the more things we can do that make the lockdown more bearable and more socially just, we will do. Thank you very much, Toby. And the next question is David Williamson from the Sunday Express. David.
Thank you. Secretary of State, how seriously is the government investigating concerns that China may have been less than transparent when coronavirus first appeared? And if it's shown that this actually hampered efforts to prevent a global pandemic, will Britain be at the forefront of a bid to claim billions in reparations?
Well, thanks, David. Well, as the Foreign Secretary and the Prime Minister have said in the past, at the moment, as you would expect, we are 100% focused on trying to tackle coronavirus. That's what all parts of government, as indeed many other people across the country, are focused upon, and that's the right thing to do. There will come a time when we will want to analyse the origins of the virus in detail and consider the actions of other countries. But that's not now. The task for us as a government now is to ensure that we get the United Kingdom through the virus as best as we possibly can, and to work internationally with our friends and partners who want to come together, whether that's on vaccine research, and we're one of the world's leading contributors to that, or the international supply of equipment like ventilators and PPE, which includes very important imports to the UK from China. But we will want to consider what's happened carefully in the future.
Right. And if I could just follow up on that, our polling shows that there is huge unease about the idea of going back to normal life. And there's even been suggested that perhaps the government's campaign has been a little too successful. How would you persuade people to overcome their fear about venturing back into normal life? And to save the economy, will the message essentially be stiffen your upper lips and go forth to shop?
Well, look, the good news is that the message that was crafted by scientists and leading medics like Jenny and her colleagues has been listened to by the vast majority of people across the country. People did adhere to the restrictions, although they were very difficult for people's lives. We heard earlier in this press conference that 1.8 million people have been asked to stay at home with almost no face-to-face contact outside of their household, and yet most of those people appear to have done it to protect themselves and to protect the rest of the country. We're going to think carefully, and the Prime Minister will be saying more about this next week, about how we can approach the next phase of the virus. And again, we'll be guided by medical opinion. And I think you heard when the Prime Minister spoke at the press conference the other day that we will be taking a careful, cautious approach to that, because the overriding objective is to ensure that the rate of transmission remains below 1, that we build in some headroom there to protect the NHS and ensure that it doesn't get overwhelmed at a later phase by a second peak. And so as we begin to think in the future about easing those lockdown measures, it will be approached in a very careful manner and monitored on each occasion to ensure that we're not seeing that rate of transmission rise to an uncontrollable level and an exponential rise in the virus. And in that way, we'll slowly bring the country out of the measures that we've been through and to a slow return to normality. Jenny?
Just to support that, I think, I mean, we recognise there was a very good interview I was listening to earlier this morning with a public health professor from Edinburgh, I think, highlighting the behavioural aspects of this. So both being in quarantine or tucked away in your own home has very significant psychological effects. But as you've highlighted, actually, people need very clear messaging to understand when they can come out and to be reassured that it's safe. And whenever you're handling any public health response, actually, it's always really critical to consider how people are feeling about it. It is not just about the science of how the bug gets around, because a lot of the interventions that you use are completely unsuccessful, unlike here, if people are perhaps not familiar with why you're trying to do things and to understand them. So I think, as the Secretary of State said, as we've gone into this managing the peak, the public have been brilliant in following that social distancing advice, and we need to make sure that we explain the different interventions that are proposed, why we're doing that, so that they can understand, I think, and hopefully support us.
Thank you. Thanks, David. And the last question, if I may, is from David Wooding from The Sun on Sunday.
Good afternoon. One issue which is raised constantly by our readers is children and schools. They're being deprived of their education. The parents wonder how they can go back to work, even if they are able to return back to work, and also elderly people who fear an extended lockdown, even when the world or the country starts to return to something like normal. Can you give some hope to parents of children whose education is being put on hold, and also to the older people who feel prisoners in their own home? And if I may just add a quick one on the app, which you've talked a little bit about today. I'm told it relies on about 80% of people using that app, yet WhatsApp, which is quite a popular system being used, has only got 67% of the population using it, and that was set up 11 years ago. So how is that app going to work?
Well, thanks, Dave. Well, on the app, as I've said, I think there's reason to believe that given the nature of the crisis, given the overwhelming national response from people in all parts of the country so far, that people will get behind it, will download it. You can see the international examples of other countries that have had some success in this area, but the UK, I think, is well positioned because we're both a country which is fairly advanced in terms of technology, and where there's great affection for the NHS and people want to get behind this as a cause. So I'm certainly optimistic that there will be a good response to that. In terms of schools, well, the Secretary of State, Gavin Williamson, has said that we're not today able to give a date to parents for the return of schools. He has said that that's going to be done carefully and may well be in a phased manner. And he's working very closely with teachers, with schools and with the unions to ensure that all of the necessary measures are put in place to begin to plan that when it's the right time to deploy it. We're very focused on how we can ensure that all children get a good quality of education whilst they are at home, and I understand how difficult that can be. Homeschooling is not easy, particularly when one or both parents are trying to work from home as well, and I've seen the anecdotal evidence so far, but important evidence nonetheless, of the differences in the quality of education being delivered to different children, and some of the most vulnerable children in society appearing to receive less education than those in other households. It's for that reason that the Education Secretary has taken steps such as ensuring that households that don't have internet access can receive modems and connections if they need it, that children whose parents don't have tablets or computers available to them can get access to those so that they can do online learning, that we've created the Oak Academy, the online learning resource for children and for teachers, and we'll take further steps that we need to. As Local Government Secretary, I'm very focused on those children who we know are vulnerable and who would otherwise have been supported and monitored in the school setting, but who are now, in many cases, at home and less visible. And local councils are doing a very good job there at trying to maintain contact, whether that's through visits, not always possible for social distancing, but where it isn't, phone calls, Skype or Zoom meetings to try and have a conversation with them, their parents or their carers. And that's a particular focus for us in the days and weeks ahead. Jenny?
Thank you. So I think just on the epidemiology of disease in children, I think is really what you were asking as a background to some of that question. We are continuously in contact, so a lot of clinical colleagues link routinely with specialists in other countries, because at the moment there are a number of different approaches, but actually we're probably all looking at the same evidence and concluding and judging that within our own settings, and the social setting may be different as well. What we do know for children is that if they get infected, they tend, or younger children probably, tend to have less clinical disease. And if they have clinical disease, i.e. they show some symptoms, they tend to progress less frequently to severe disease. So that's pretty good. The bit that is perhaps still in the unknown box at the moment, and some of our prevalence studies will really help us understand, is the transmission of disease. The quality of the evidence is quite difficult at the moment, so you shouldn't take this as the truth, but there are some signs, let's put it that way, that potentially younger children, and I mean say infant junior school age, are less susceptible to disease and potentially transmit it less, but those are very early indicators, if you like, and they need testing with proper, robust evidence. One of the things which is important is older children. I think the evidence is far less clear, and there may be some biological reasons for that, for the way older children handle disease and going through puberty, for example. But the thing that's really important actually about settings is actually how children interact with communities. So I think it's not just about the transmission of disease. We need to be thinking about what are the behaviours that go with it. It's a bit like the have you gone to the pub on the way to the outdoor event. Actually, younger children might well be much safer settings, because on the whole, parents aren't taking them so far. They may be going in a buggy to the local primary school or whatever it is, whereas older children may be travelling longer distances. So whole number of behavioural issues as well that need to be thought through when we have firmer evidence.
Thanks. And Dave, would you like a follow-up question to close this afternoon?
A little bit about elderly people, perhaps.
Sorry.
Some kind of hope for them, because some of them can't. We had a question from a member of the public the other day who said that they couldn't hug their grandchildren, which I think struck a chord with a lot of people.
Absolutely. I'm sorry I didn't answer your question there. Look, I think it's very difficult for those people who we've asked to stay at home, and that's both the shielded, who have the extreme clinical reason to stay at home to protect themselves, but also just the many, many other people who, having taken our advice, have chosen to stay at home. And we want to be able to offer them the hope that we're getting through this and there's going to be, in time, a return to normality. I think the fact that we've passed the peak is great, and that's as a result of all of the hard work that people have put in across the country, those working in the NHS and social care on the front line, but also the millions of people who've chosen to stay at home, not least the elderly. From our part in central government, what we're saying is that we're going to do everything we can to continue to support them, whether that's through the delivery of our food boxes, 1 million of those delivered already, ensuring that they get the medicines that they need, ensuring that people are phoning them for their mental health. And if there's further steps that we need to do to help to make life for that group of people more bearable, more livable, more humane in the weeks and months to come, then absolutely we'll do that. Jenny, is there anything you would like to add?
I don't think so. I think it refers back to the old point. Obviously, if we have more evidence as that grows and we can use that, for example, perhaps with younger children and transmission, then we can perhaps make different recommendations. But just to, it is important, I think, that older people, it is very clear that they are generally at increased risk, and particularly people with specific underlying conditions who've been advised to shield. It's for them to choose, but I think we all want to make sure that they stay safe. So while we are over the peak, but we're not out of it by a long way, and so we would still advise them to keep taking those precautionary steps.
Absolutely, and none of us would want the restrictions to last a day longer than is necessary, but for that group of people in particular, especially the shielded, it really is important for their own protection. Thank you very much, Dave, and thank you to everybody watching at home this afternoon.